welcome back. There's something about technology in the healthcare industry that really resonates with me. But let's be honest, no one really likes spending time in hospital. Well, today my guest is Ken, founder and CEO of Personify Care. What Personify Care set out to achieve, amongst other things, is to reduce the readmission rates of patients back into hospital after surgery. And that's a pretty great thing for the patient and for the hospital and for the clinicians and our healthcare industry in general. In our interview, Ken covers a lot of ground about building a tech company, including, is there really any greater purpose in your work than helping save lives? And when building a new product, decision-maker engagement is really good, but designing anything without the ultimate end users having their input will see your product sit on the shelf. He also covers that the process of getting well doesn't stop when you leave hospital, how perceived risk in a complex industry like healthcare can hold back innovation, and that technology companies and service don't have to be mutually exclusive. My name is Ben Campbell, and this is The Self-Made Theory. Thank you very much for having us along today to talk about the story of Personify Care.
Absolutely.
So let's start with your elevator pitch.
Sure. So Personify Care started around 4 years ago, really from a fundamental belief that patients deserve the best possible care even after they leave hospital, and the realization that clinical teams within a hospital or clinic actually deserve to be spending most of their time actually caring for patients rather than doing a whole bunch of mundane admin manual processes. So since then, what we've developed is really a mobile platform that allows us to help clinical teams really track and monitor the patient's recovery from a procedure or a surgery after they've left, and also prepare them for a procedure before they've come in. So really allowing clinical teams to deliver these evidence-based protocols that have proven outcomes that more often than not don't reach patients because we're still using paper forms and phone calls in the health system.
Mm-hmm. And so does that help follow what needs to be done post-operative or post-care, post-operative care, but does it also help the patient keep track of what they should be doing and and their process as well?
Yeah, absolutely. And that was kind of part of the genesis of where we started. It was really around some, personal patient experiences. As a patient, I went through our health system, one of the best health systems in the world. As a patient, I was surrounded by a family of health professionals, and I still had no idea what I was supposed to be doing after I left the clinic or the hospital in a number of cases. And so part of where we started was, how do you provide that support and information that's needed by patients after they leave a clinical setting? Because we've all been there. We've all left the doctor's office or a hospital, and all of the important questions that we wanted to ask come to us, a day or two after we've had that interaction. So very much so our focus is on how do you provide the support that's needed to patients and ultimately improve their experience, but also reduce the chances that they're going to be bounced back and readmitted into hospital. And that's a big problem in the health system, both here and overseas.
I think we all love a story where the innovation comes out of a personal experience. I think that's a fantastic motivator often to drive new innovation. But this isn't your first gig, is it? Where did you start before Personify Care?
I mean, so I tell the story. I started life as an engineer writing code for the likes of Motorola, and I spent a bunch of my time early on in my career working in the US and Europe, really integrating phone systems into cars. So as a young engineer,
back in the day when that was a thing.
Yeah, absolutely. When a phone used to be built into the car rather than something you put in your pocket, right? But very quickly I learned that just doing pure technical work wasn't all I wanted to do, and so I spent a bunch of my career in between technical people and the commercial side of businesses and a range of different companies. And a lot of that was building tech out of Adelaide, but typically selling to customers that are typically being overseas and predominantly in the US and Europe. So the last major role that I had before getting involved in healthcare, I spent 7 years in a company called Euramigo. So one of Adelaide's best kept secrets, a search company that was essentially using lots of data to make it easier for consumers to find what they wanted to buy from big online retailers like Sony and Reebok and Dell and others. And part of that journey to getting involved with and starting Personify Care was really about, I learned from that experience was You make it easier for a consumer to find what they wanted to buy, and they'll buy lots more stuff. So we said, well, how can we apply some of those same principles to helping patients do what they need to do after a procedure? If we make it easier for them, maybe they'll do more of it, and maybe they'll have better health outcomes and less complications after a procedure.
Wow, fantastic. So what was the first step? You determined a need. What happened after that?
Yeah, so I'm always skeptical of these stories where there's a light bulb moment where everything happens overnight. I think the very first step, for me was the trigger was I was still working at Euromego, and I came home one day and was telling my wife, who's a healthcare professional, a pharmacist, telling my wife about the record revenues that we'd achieved that month. She said, "Well, I saved 2 people's lives today," and I said, "Well, you win." And that was part of the story to how I got interested in healthcare, where the problems are so large and the impact you can have is so significant in an individual, but a whole health system's perspective. That if you could use technology to reduce that friction between and get the information to both clinicians and patients at the right time, you could have a serious impact, both from a financial perspective, but more importantly to someone's life, right? And so that's kind of where we started. So I got really interested in the healthcare space more generally. Did a few projects here and there, getting my hands dirty, so to speak, in healthcare, and really started Personify Care when we identified that this journey after hospital was a big problem. That 1 in 5 patients across the US and probably Australia, depending on the data you read, 1 in 5 patients gets readmitted into hospital after a surgery within 30 days.
1 in 5.
So that's 20% of patients that go into hospital are going to bounce back. And so not all of those are avoidable, but a big chunk of them would be. And so what can we do to keep people from bouncing back to hospital? So we found this opportunity where you could help the patient. This readmission problem was a huge financial burden on the health system. And increasingly, hospitals themselves were being made accountable for that readmission. So increasingly in the US and also to some degree here in Australia, hospitals are now accountable financially for that readmission. So either there are penalties for readmissions within that 28-day or 30-day period. So it was this interesting problem where you could improve the experience for the patient, but also solve a commercial problem which we needed to find. Otherwise, it's a nice, in theory, idea, but not really a commercial proposition.
So if hospitals were being held more accountable, what was stopping them from creating a solution like this themselves?
So I mean that's a trend that's still flowing through the healthcare system, and one of the things that we realise is that if you look at the numbers and the proportion of our state budgets and our national budgets that's being spent on healthcare, it's growing every year, and so it's like every Western population, aging populations means that every time someone goes to hospital, they're more likely to be admitted because they're older, they have other comorbidities, they're more complex, and increasingly we're asking our clinical teams to treat them faster, to get them out of hospital more quickly, and so it's one of these things where in healthcare, I often get asked why is healthcare adopting technology so slowly. So on the one hand, doing the same thing that we did yesterday is safe, and we're dealing with people's lives. So unless you can prove that what you're doing is as good or better than before, you're probably not likely to just experiment with new things, right?
And also, I assume there needs to be some level of guarantee that sits around that new thing that you're going to do. Absolutely. Because being safe and doing it the way we've always done it provides at least a safety net to fall back on, doesn't it?
Absolutely.
If something happens.
But I think sometimes that gets used as a reason not to try something, right? So what's the cost of doing nothing? What's the cost of not following up with these patients after they've left? Often that gets missed in the conversation, and just falling back to what we've done previously is works. And I think what's driving change is the financial imperatives around this thing, that that if we keep doing what we're doing, no one's going to be able to afford healthcare anymore.
And I assume it's no different in the public or private sector, because private sector is driven just as much by profitability as public.
At the end of the day, particularly in Australia, we're paying for it one way or the other, either through our taxes or our health insurance premiums, and one way or the other we're paying for it. I think the other challenge in healthcare, but from a commercial standpoint, is working out who pays for anything. So unlike other industries where you have one customer and you're going to go and sell to them and you're selling to them a specific value proposition, in healthcare you always have the patient who needs to be looked after, the clinician who has top of mind, how are they looking after the patient and what quality of care they're delivering. And then typically there's an organization like a hospital that's wrapped around that. And you almost have to provide value to all those three kind of component side of the equation at the same time. Otherwise, you're just doing something good in theory, but doesn't really last for very long. So we always say we look for opportunities where we can improve the quality of care and experience for the patient, save time and effort for clinical teams, but also save money for an organisation. If we can do those three things at the same time, then you've got half a chance of getting something working in healthcare. And
is it different in places like the US where the health insurance organisations play perhaps a more significant role than they do here in Australia?
Yeah, certainly the funding models and the way things are funded generally is very different in the US. But fundamentally, the problem we're addressing is exactly the same. At the end of the day, when someone gets a discharge from hospital or we're preparing for someone to come in to have a treatment or a procedure, there are financial penalties one way or the other to the organisation. There's a whole bunch of time and clinical time that's chewed up trying to get patients ready and tracking how they're going post-discharge, and there's the patient in the middle trying to get the best possible care in the process.
So your wife beats you down one day and tells you that your job isn't important, right? You go off and do some projects in health.
And I agree. Right?
You go off and do some projects in the health arena. What was the first step in kicking Personify Care off?
Yeah, so the first point where I found a developer that I'd worked with previously who spent a few months pulling together an early prototype of what we had, just so that we could go in front of customers and potential users of our system and get some feedback. And so we did some very early pilots with a few and got some feedback in a whole range of different areas. And then early on we didn't really just focus in on the surgical journey post-discharge. We were experimenting with a whole range of different settings. And then I got introduced to Ivan, who's now our CTO. So again, he was an engineer who'd worked in a whole range of different companies and industries. He'd done some study in the US, worked in the US, and now living here in Adelaide. And we shared that experience of having a partner who was a health professional. So his wife's a doctor, and both of us had this view of the world where we were seeing the system both as a patient, but also in the eyes of a clinical person. And to us as engineers, it made no sense whatsoever that valuable clinical time was being spent collecting information from patients over the phone, reviewing information on paper forms, and really trying to work out who are the patients that need our help today, right? And so working with him, we really developed our first real version of our product. And our first break was with a local hospital, private hospital here in South Australia, who saw something in what we were doing, probably a bit innovative in the way they were doing things, and agreed to pilot what we were doing with a I think at the time it was about 100 patients. And so we did our first pilot with breast cancer patients. So they're having breast cancer surgery. And we ran a pilot to demonstrate the value we could add to both the patients and the clinical team. And to Ivan's credit, it worked. And he developed that technology early on, and we managed to get some early good results that we managed to kind of present at a conference and started to get some real credibility from that point on.
Wow! And so, were you still working at this time, or had you sort of made the jump out to do Personify Care full time?
No, so when we first started, I'd left Your Amigo for a couple of years and was doing some contracting work on the side to to pay the bills. For the first 6 months, Ivan was doing it on nights and weekends,
Yep.
and for the first year and a half, we were really just doing it part-time until we really could prove that what we were doing had some kind of commercial merit, as well as we knew it was going to help patients, and we knew we could save some time for the clinical team. Is, how do you line that up with something that actually has a value proposition to someone who might buy this as well.
And so first trial, obviously successful. Where to from there?
So from there, we'd worked out that, okay, we've got something that patients would use, and there was a lot of skepticism at the time about, well, would the older demographic use a phone to track how they're recovering and communicate with their clinical team? So we had something we knew that had some legs when we got some feedback from clinical teams, from nursing staff typically, that were caring for these patients after they'd left hospital, that this was a problem. That if we could save them some time, that was a scarce commodity. And if they could spend more of their time on the patients that actually needed them rather than processing paperwork and screening patients manually, then we might have something there. And I always tell the story that some of the very early meetings we had with those experienced, dedicated nursing staff, we would walk into a room and we were early on thought we had the solution to everything. And, the early feedback was, Ken, go away. We've got patients to look after. We don't need another bit of technology creating more work for us. And a lot of our time was spent really trying to understand that a lot of the technology that come before really created more work for people rather than save them time. And so a lot of these systems that are in place at the moment are still, were written and designed a decade or two ago. And by and large, didn't involve the people caring for patients in designing those things as well. So from that, we learned very early on to stay really close to those key people that were looking after patients. And so that's now part of our mission, is how do we help clinicians who work really hard every day to look after patients? How do we help them help their patients? How do we allow them to do their best work and deliver these evidence-based protocols that often don't reach the patient because we're spending all our time just dealing with the noise and the paperwork?
Continually fascinates me about technology projects that end up not delivering, and there are case study after case study, example after example, and South Australia is no orphan there. There's plenty of them around.
Oh, absolutely.
And it obviously makes it harder for those that do have a great outcome, a great outcome for both patients and for hospital administrative and clinical staff to actually get their technology in, because they've got to not only convince and show that they can deliver the value, but also they're selling against the stuff that was sold 10 years ago or 5 years ago that never delivered.
Yeah, I mean, you're almost dealing with the perception of what's come before, right?
That's right.
And that's part of where we went next. Was we had something we knew had some value, right? So now how do we turn this into something that isn't going to need to be supported indefinitely by government grants, etc., right? So how do we create a commercial model that allowed people to buy this, right, and allowed us to grow our team and grow our technology? So we decided to try and do something different. So we said, there's this whole software industry around that's called software as a service, where you go onto Netflix, put in your credit card, they charge you a monthly fee, and you get a service, right? So the one thing that was very evident at the time was that technology companies and service were two things that often don't go together. That you often got charged for service, right? You often got charged to pick up the phone and talk to someone about a product in healthcare. So we said, let's try and provide software as a service to hospitals, to the point now where we're charging a monthly subscription for any staff members that need access to our system, and we don't charge a big upfront implementation fee. We don't, there's no need for a big project upfront. And so when we talk to people now, it's a big part of what we're selling is you can deploy what we're doing in a week or two. We're allowing you to plug in your existing workflows and protocols, and you can do that with an interface where you literally drag and drop things on a screen. And you don't have to change anything about what you're doing. There's no big project management thing. It's not going to cost you millions of dollars to deploy a big EMR system. you can deploy us in a couple of weeks and save up to 60 to 70% of the time you're spending at the moment processing paperwork, and spend all of that time looking after your most sickest patients, because you actually know who they are without extra work and effort. And so that was a big change, and it took us a while to realize that we have to over-communicate that, because when we walked into a room, people just assumed it was going to be a project that was going to take at least 12 months' time and a few $1 million to deploy something like this.
You've just removed almost every barrier to selling it.
Yeah, and part of that is shamelessly copying the business model of what Your Amigo did, right? A big part of what they were offering was a service that generated more revenue for online retailers, right? And that's how they sold it. They said, well, we'll generate more revenue for you, and that's all you have to worry about. And that's, in a way, what we tried to emulate. Remove every barrier that might be in place for a hospital or a clinical team or a clinician to adopt what you're doing, and let them see the value you're generating. Early on, we had a lot of good meetings from people who were really interested in what we're doing, and we'd get some groups that said that we wouldn't hear from for a few months, and then we'd call them up and say, well, just following up on how that presentation went 3 months ago, what happened? And they'd say, oh, well, we got stuck at the business case. We kind of were trying to work out, what the ROI was, what the return on investment was going to be, and we would, well, I would say, well, we can send you a bunch of case studies if you like, but why don't you just try it for a few months and measure it yourself, and you can have your own case study to work out the return on investment for you in your particular case, right? And if you don't like it, switch us off, and you would have lost not very much, right? That'll be a lot quicker than us giving you thinking about it for 3 months, and that's and in that particular case, they said, fine, send us an agreement, and we'll start in a month or two, and that's what we're trying to do, I guess, is make it really easy for clinical teams. They've got enough to worry about without having to spend months thinking about how to deploy a new technology that's going to change everything. Right?
Fantastic. Yeah. So where are you today? So I know you've been involved in some overseas deployments. Is that right?
Yeah. So a big part of when we started, a big part of what we were trying to do is how do we start here in Australia, but again, going back on my experience before, a lot of my experience was building tech in South Australia, and then predominantly spending my time in the US market. The US has the problem we're trying to solve is 10 times bigger in that market. So that readmission problem we were talking about costs about $130 billion a year to that health system. And the incentives, the financial incentives for clinicians, hospital systems, surgical centres, are probably a year or two ahead of where we are in Australia in terms of improving patient experience scores, improving healthcare outcomes for patients from a financial perspective. So our focus was, well, how do we get to the US market, and how do we try something there? And it was almost through some, timing is everything sometimes. We were made aware through Australia, actually, through a program that was set up by the Consulate General at the time in Houston. They were setting up a BioBridge program that connected the Texas Medical Center with Australian digital health companies. So the Texas Medical Center is the biggest medical center in the world, has the biggest number of hospitals, and the size of the Texas market for what we're doing is just as big as the Australian market as a whole. And so we were last year one of 3 Australian companies to be invited by the Innovation Institute to go and work with them to really test what we're doing in the US market, work out all the compliance things that we needed to cover if we were going to go into that market. So it really came at a perfect time. We'd really started some of those processes already with plans to go in there. But it's one thing to have a plan and another just to rock up in the US and say, we're starting. Right?
We're here.
Yeah, exactly. So that provided us a great opportunity, a great stepping step to both test whether what we're doing really made sense in that market, but also really get in front of some of the key decision makers and influencers in that marketplace. And so through that, we got introduced to a bunch of different providers, different connections, and learned a lot through a program that was run over a period of 4 months. So I spent the majority of the 4-month period in Houston, and we ran our first pilot in the US to really kind of test a lot of these things that we tested here in Australia. And what we learned there from that was how are we going to get our first customers? What will our first customers be? And surprise, surprise, it's completely different than what we thought it was and what it is in Australia. So just last week, so since then we've just last week brought on our first full-time business development manager in Houston who started working for us there with the view of kind of going out and attacking that market pretty hard.
That's super exciting.
Yeah, no, it's very exciting, and the opportunity to go and work with the biggest medical center in the world and test what you're doing against some of the best companies from around the US and across the world, actually. So they had about 20 odd companies that had come through the program with us, and learning from some of those connections and having those connections was tremendously valuable for what we were trying to achieve as well.
I think the natural question is, can you continue to drive this out of Adelaide into a global market at scale? What's your thoughts around that?
Absolutely. I mean, I have no doubt about that whatsoever. There's so many advantages about running a global business out of Australia generally, but in Adelaide in particular. And as I tell everyone, I've never done anything different, right? Literally every job after finishing my engineering degree at Adelaide Uni has been working in Adelaide, predominantly developing technology solutions, but working with US customers. So I've never known anything different.
Well, you're the opposite to probably most people.
Yeah, and I guess my attitude has always been that Adelaide's a great place to build a company as long as your market's not just Adelaide. So if your market's just Adelaide, then you probably have that constraint of a relatively small market. But if you're doing something in technology in particular, there's absolutely no reason why you can't build high quality technology out of Adelaide and sell to an international market. It's not straightforward. It's a lot harder not being able to walk down the road and talk to your customers. But there's no reason why it can't be done. And we have a lot of advantages. We have 3 good universities that produce high quality talent every year. Our lifestyle, while some people might see that as a kind of Achilles heel, I think provides a lot of benefits to people that are working with you as a team. So if you can find a way of building a team and building a company out of Adelaide, why else would you want to live anywhere else, right? And then there's just some basic cost advantages. Try and hire a team of engineers in San Francisco right now, and you're probably paying a little bit more than you would pay for a team of people of the same caliber here in Adelaide. So, and so one of the things I've always said is that I think one of the keys is if you're going to go into an international market like the US, you probably want to find local people that have experience in that market that speak that language. And when I say speak that language, I don't mean English, right? So people in Houston speak a very different language to people in California and a very different language to people in Adelaide. So that particularly in healthcare, there's a lot of idiosyncrasies that I think people underestimate. So I think that's really what we're trying, to have customer-facing people in the markets where we're targeting, but then develop the core technology out of a team here in Australia.
So if you're looking into the future now, you've got a strong base in the US with some great customers. What about the UK? What about the NHS? What about other markets around the world?
Yeah, I think we'll probably take one market at a time. I mean, every time you go into a new market, there's a whole bunch of compliance and regulatory steps that we have to take. And I think for us, the future of what market we go to next. There's a huge opportunity in Asia. There's huge opportunity in places like the UK and Europe. But I think before that, I think there's a bigger opportunity for us as we grow the number of hospitals and clinical groups that we're working with, and start to collect some really good data. There's an opportunity for us to start to prove what clinical benefits we can have on patient outcomes. So over the next 12 months, one of our key areas of focus is to start to work with some research organizations and clinical research organizations about measuring what impact we can have on improving survival rates of patients, improving readmission rates, improving just the experience that a patient has in a measurable way that you can publish a paper on. So someone else measuring it, not us saying how good we are. And our vision going forward is really about, wouldn't it be great once we have some critical mass of some of this data to be able to really try and pinpoint what are the few things that patients do at home that really predict and drive really good outcomes for various types of procedures that they're having. Because if you can start to identify some of those things, you can have a real impact on a whole range of different areas beyond just saving time and effort, right?
When you're measuring your business success based on saving customer lives, it's a big outcome, isn't it? Even if it's just one.
Yeah, absolutely. And I think that's one of the things that got our team into healthcare to begin with. That if we can start to use technology not only to save some dollars, but save some lives. And if you can do that in a way that the more successful you are, the better outcomes you can have for patients. That is the purpose of our company. How can we have a meaningful impact on patients' outcomes, both in terms of how many patients are we helping, but how big an impact we can have. Because the more we do that, the more time and money we're going to save for everyone in the system. And the more successful we're going to be commercially. And in my mind, the two things don't have to be mutually exclusive, that you can do both and do them well.
I had an email from a customer of mine a little while ago in the health sector about some technology that we deployed. And they said that because of the technology that we deployed, the diagnosis of the patient was so much quicker than perhaps previously available to them, which then saved the customer permanent brain injury compared to had they not had that technology. And all of the history and the effort that you go into putting that technology in place just is minuscule in comparison to just to that one email about the impact on a patient's life. It's amazing.
Yeah, and I think they're the stories that really keep us going as a team, right? I mean, so we just presented a case study with one of the hospitals we're working with here in South Australia that brought in our system about a year and a half ago, and I still remember the story of within 6 months of them using our system, we were getting stories from the nursing staff about patients that had an orthopedic knee replacement, and because they were being monitored against their protocols through our system, they caught the fact that this patient got somehow put on warfarin a few days after they had surgery, and their knee that just had surgery was blowing out, and the reason they picked it up was that they were being monitored through our system, right? So that could have been a really dangerous outcome for that patient. But to be able to find that needle in a haystack is kind of what we're trying to achieve as well.
Yeah, that's cool. So every startup has its challenges. Every startup that moves into successful business has its challenges. What hasn't worked for you? Or what have you found most challenging so far?
Yeah, I think, I know it sounds like a cliche, but things always seem to take longer than what you plan, right?
Particularly in healthcare.
Right? And when we first started, we thought, well, if we found something that made a lot of sense to patients, then surely we're on to a winner here. Right?
And why isn't everyone just snapping it up right now?
That's right. And sometimes that's the reaction of the people that have joined our team recently is, you talk to them, and that's part of, how we pick the people that are part of what we're doing, that they really believe in what we're trying to do, and then they kind of are trying to present what we're doing to the broader world and broader market, and things don't happen as fast as we'd like them to sometimes, and sometimes that's the challenge: is how do you plan for the best but prepare for the worst, and find that balance between how fast you try and go down a particular direction. And so for us, we're kind of trying to use this approach of, particularly in this space of how do we reach our customers as efficiently as possible, thinking about it in terms of a lot of little experiments where we run a bunch of different experiments and learn what works and doesn't based on feedback we get from the market, from customers, from clinical teams, and then spend more time on the things that start to show some signs that they're working. And generally speaking, that's the direction I'm hoping we can drive this company's is while we have a very patient focused and customer focused purpose, is how do you drive a lot of this stuff through measuring things and be as data driven as we can be.
Good stuff. Well, thank you very much for sharing your fantastic story. I'm pretty excited to see what happens next for you. And it's a great story for both South Australia and really for all of us because of the outcomes that it delivers for patients. So thanks very much for sharing the story.
Thanks. Thank you, Ben.
Cheers. I think my favourite part of Ken's story was when he was telling his wife about his great achievements one day at work before he started at Personify Care. And when he asked her what she did that day, it was like, oh, I saved 2 lives today. Boom. Well, that certainly puts into perspective what we consider important in life. If you want to find out more about Personify Care, then head over to our website, www.theselfmadetheory.com, where you will find all the ways that you can contact Personify Care, plus you'll see my show notes there as well. If you're enjoying our stories and interviews, then drop us a line or let us know via social media. Hey, maybe share it with your friends and colleagues. Until next time, keep innovating, overcoming, and prospering.